Hi, I'm Josh Rushing in for Femi OK, and you are in the stream. Is Afghanistan's healthcare system on the verge of collapse? But first, look, if you're joining us on YouTube, be sure to chime in. I want you to see this over here, okay? Share your comments, your questions, and we'll try to address them during our live discussion. Now, here's the situation. International aid money needed to keep the healthcare system going has been held up because of the Taliban's international designation as a terrorist group. Al Jazeera's Charles Stratford recently filed this devastating report after visiting the country's largest public hospital.
Alan Nazar had to travel 12 hours with his sick mother to this Kabul hospital to get the life-saving dialysis treatment she needs. If she isn't treated every couple of days, doctors say she could die within 2 weeks.
People are living in poverty. Their situation is bad. Patients need dialysis and treatment. If they don't get it, and the foreign aid stops, and if people can't afford the treatment, it's going to be very difficult.
This is the largest public hospital in Afghanistan. The dialysis department is mainly funded by the World Bank, along with money from the previous government. But hospital staff say they haven't seen any cash for 3 months. They can't buy vital equipment and medicine, and they last received their salaries in May.
And joining us to discuss what can be done to avert a disaster in Kabul, Dr. Wahid Majrooh. He's the country's acting health minister. In Paris, Diwa Samad. She's a former deputy minister of public health for Afghanistan. And in Cairo, Dr. Richard Brennan. He's a regional emergency director for the World Health Organization, whose jurisdiction covers Afghanistan. Welcome, everybody. Dr. Majrooh, I'd like to begin with you. You were the acting Minister of Public Health before the transition from the U.S.-backed government in Kabul to now Taliban control. So I'm curious from you, what was the plan for Afghan healthcare system by the U.S. and by the government in Kabul after the U.S. announced that they were leaving?
Thank you very much. The withdrawal and the transition happened just out of the way it was expected, and it did not give the opportunity for health system, specifically in the context where the last few months of the last regime was fully involved and focused on the fighting and ongoing conflict in 34 provinces. And I should say that even during those days, the Ministry of Public Health and the health sector was one of those sectors deprived of required inputs and resources needed in those at that phase of the operation. And as you rightly said in your report, we have our staff members who has not received their salaries for the last 3 or 5 months, which shows that the extent of the dilemma and the challenge goes beyond the last 3 or 4 weeks. So, in general,
can you illuminate why they haven't received their pay for the last 3 or 4 months when the Taliban only took over a month ago?
As said, the major focus of the former government for the last few months of the system was focused on conflict. It allocated money to the Ministry of Defense and Ministry of Interior Affairs, and the midterm budget review, which had to happen in the last month, unfortunately, was delayed due to the escalating conflict in the country. Besides that, the change in the contracts with the implementing partners in different provinces and the bureaucracy of the government, as well as the World Bank, was another factor delaying the process of contracts to be signed with different NGOs. The challenge which we are now in today is a multidimensional, which roots in different factors. But the main topic was and is the conflict in the emergency, which escalated in a way that was not predicted by any national or international role player in the country and outside.
Yeah, but I can't believe it wasn't at least one of the possibilities that was being considered. I mean, I'm sure they hoped that it wasn't going to happen this way. I'm sure they hoped it wasn't going to happen this fast. But they had to say, what if? What if the Taliban rolls in before the U.S. is even out of here? And in that case, Diwa, I don't know, when did you leave Kabul, Diwa?
I left Kabul on the day of collapse of Afghanistan. It was a terrible experience. I was working on, prior to leaving Afghanistan, I was working in an advisory role. I was providing technical health support to the Ministry of Public Health. I was working in close collaboration with Dr. Majrooh. Now, I remember working on increasing health need of IDPs in Afghanistan, and COVID-19 response and ensuring cross-sectoral collaboration in regards to these two important areas. But as of the last week, there was increasing sign of collapse of the government. Provinces were falling one after another, starting from Nimroz and ending up in Kandahar and Jalalabad and many cities that we were not even predicting. There was a lot of rush on banks. There was exchange rate. The Afghani lost its values, and these were the signs of collapse. And then we were informed that Taliban had reached to Kabul doors, and there were signs of shooting, and that's how I managed to go to the airport, and I was able to catch the last flight, but many people had a lot of trouble leaving Afghanistan. I'm the only one who left from my family, and my family is still in Kabul.
Are you worried about them?
Yes, my sisters, who are also healthcare professionals, they have worked in health facilities. They're doctors. They're in Kabul. I'm worried for them. They're at home.
What do you hear from your sisters? Are they still going in to work, and what's the situation like?
My sisters, they are not going to work at the moment, although the Taliban, they have announced that women who are working in healthcare, they're allowed to go to work, but fear is very dominant. There are increasing, from the reports we hear from Afghanistan, there is increasing human rights violation. People are scared, including my sisters. They are not going to work, especially that they were working at police and military health sector, not public health sector. So at the moment, they're not showing up.
Rick, you're with the WHO. Where's the international organizations on this? Did they see this coming? Did they anticipate that the money was going to be cut off and that this healthcare system could collapse?
Well, I think as Dr. Majrooh said, there hadn't been much money flowing into the health system for the few months before the government collapsed. And I think that our focus as humanitarian agencies during the Taliban advance was really responding to the humanitarian needs that Diwa referred to, the internally displaced people, the high levels of trauma and so on. But we did not expect to see, I can't say that in our planning we anticipated the acute pause of funding coming from the main donors, and then which was announced around the 26th of August. And then you saw the NGOs that are implementing the basic package of health services that Dr. Majrooh mentioned. They wrote a letter on the 31st of August to the ministry saying, we're not going to be responsible for the continuity of health services after the 10th of September. So now we're faced with this very high risk of massive closure of health facilities. We've got to have an immediate response to that. We're working with health sector partners. We've identified around 538 health facilities, priority health facilities across the country for immediate support. And at the same time, we're trying to work with the donors to find out, as you rightly said, because of their own internal rules and regulations, they're not able to fund any structures in a Taliban-led government. Well, they've got to find some other mechanism to fund the health system, because they were responsible for funding over 2,300 health facilities across the country. So we're working with them to say, okay, we'll try and fix things with the 538 priority facilities, but we need an urgent fix to ensure that the money starts flowing again through a new mechanism so we can get those over 2,000 health facilities back on track.
Dr. Majrooh, you were now part of the Taliban government. What are they saying about this internally?
Well, I'm still there in the ministry. One out of several roles I want to play is to communicate the extent of the challenge that the people in the health sector is facing and to communicate the sense of urgency. I've been trying to make sure that I am successful in that role, but in some parts I should say that I feel the failure. The sense of urgency we have in the way we expect that it is felt on the other side is different, but at least verbally I'm assured that they're concerned about it and they're trying to find a solution for that. But at the end of the day, this is the technical part of the ministry. Me and my partner, my friends who know the language of donors, the limitations donors are facing with, and the possible mechanisms and successful experiences in similar contexts here in Afghanistan 20 years ago in other regional countries, which donors had to shift their approaches, their policies, but at the same time, there were possibilities of channeling funds, contributing to the health sector through different mechanisms. Just to reconnect to your question before, it is one part of the question in the game was how we anticipated, and the other part was our understanding of the responsibility of our donors. Just to be very honest, I thought they would act more responsibly rather than just freezing everything at once. And I should say that the impact of the funds being frozen goes beyond the direct contribution of the World Bank. In your report, you noted out that the hemodialysis project, which is implemented in Jamhuriyat Hospital and 10 other hospitals around the country, is funded through the government. But unfortunately, although we have an approved legal contract for the supplier to provide supplies for the hemodialysis centers around the country, but this contract, along with 10 more of 100 more other contracts, are not fulfilling the legal and contractual obligation, because they say that when the major provider, the major contributor, which is the World Bank, has frozen their funds, then how can you guarantee that the government or other smaller donors will continue fulfilling their commitments? The rippling effect that the reaction had goes beyond the 2,500 health facilities, which are directly funded by Sahat Mandi and the World Bank, USAID, European Union. Unfortunately, the government-run hospitals, which are 22 in Kabul, 13 in other provinces, are in the worst condition compared to those of World Bank-funded facilities. So,
hey, Rick, you wanted to jump in on that.
Well, yeah, I think that this is the big issue right now. So, we as the World Health Organization, we are having conversations right now with the donors. They understand the issue. And it's because of their own internal rules and regulations. It's hard to be, it's hard to be too critical of them because they're constrained. They've got their hands tied behind their backs. But we need a quick decision on this. So there's a lot of conversations going on at global level about how we can free up that funding to get those 2,500 health facilities going again. At the same time, earlier in the week, you had the big humanitarian conference with around over $1 billion now released for humanitarian assistance. That's a different source of funding. We're hoping now that in the health sector we'll get close to at least $66 million, support a lot of these health facilities till the end of the year. Until we find another mechanism, but
end of the year. Can it last to the end of the year, Diwa? I see you're trying to jump in here.
And Josh, thank you. Well, I agree with colleagues that Afghanistan health sector is at the verge of collapse. I know everyone understands what the risks of lack of funding to Afghan health system is. It's important that we find out ways. I understand the concerns of donor for channeling, not channeling funds to Taliban. We need to find out alternative mechanisms. Let's not forget that over the past 2 decades, more than 80% of services in Afghanistan were delivered by non-governmental organizations, NGOs. So we need to support these NGOs. There can be an alternative or a credible intermediary like UN or ICRC to support this, but we shouldn't give up on the health sector. It's important also to note that what we shouldn't do. As my colleagues said, that there are pledges. We had a conference, a humanitarian aid conference on Afghanistan. It's important for the international community to revisit humanitarian aid that was being provided between 1995 and 2001 in the Taliban era. We have the results of that kind of investments in Afghanistan, a scattered health system with extreme inequity. Today, in this 20 years, we have established a health system with a population-based intervention. It's important that we keep this system that is run by local NGOs, by communities, by Afghan professionals. Humanitarian aid needs to support these people.
I take your point, Dio. I think it's important when we're talking about the kind of bureaucratic stuff people are dealing with and the rules and regulations is to remember that someone's mom is on dialysis in a hospital in Kabul right now, and they don't know what the future holds for that family. We have some questions coming in from YouTube. Here's one that says, are other relief sources or aid there? How can patients be helped? And I have a comment from MSF. Can we actually bring this up? This is from Gaetan Drossart. He is the Afghanistan Operations Coordinator for MSF.
MSF has been working in Afghanistan since many years. The healthcare system has always been very fragile, but today that same system is about to collapse. The reason is that the system was relying heavily on the money coming from abroad, from development banks, from government, and they decided, most of them, to stop their fundings to the Ministry of Health. So today what we see on the ground in the 5 projects location where we have a hospital is that more patients are coming to the MSF structure because they have nowhere else to go. The other health actors simply have no money to pay their staff, they have no drugs in their pharmacy, they are not able to make their structure functional, and they have to close. So it's urgent to ensure the continuation of the fundings for the healthcare system, or the entire system will collapse.
Okay, he's talking about the entire system collapsing. He's also talking about lacking supplies. I want to bring in one more piece of video before we come back to the questions. This is going back to Al Jazeera's Charles Stratford in the report that he filed from the hospital in Kabul.
So this is the clinic's medicine store. Just look at these empty shelves. There aren't even basic medicines here. Bear in mind this started out as a maternity clinic and we have pregnant women in the wards. There are no rubber gloves, there are no anesthetics, there are no antibiotics, there aren't even paracetamol tablets available here. And it's been like this now for 3 months.
Dr. Majrooh, can you walk us through what does this look like if nothing changes in 2 weeks, 1 month, 3 months, 6 months?
A health system which proved its resiliency during 3 waves of COVID-19, a health system which proved its resiliency, neutrality, and impartiality during unprecedented conflict in 34 provinces the last few months, will collapse. At least 150 mothers in need of cesarean sections will be deprived every day, which most of them will lead to death, unfortunately. Besides that, we conduct about 500 surgery operations every day in our system. At least 50% of these patients are in need of emergency interventions, otherwise they will end up to death. More than 5,000 children will be deprived of immunization services a day, and about 20,000 children will be deprived of nutrition services every day. Thousands of mothers and children will be affected based on the figures that are presented. The joint achievements that we made along with our donors and implementing partners when it comes to maternal and infant mortality will be unfortunately badly affected. At the same time, a health system, as said by other colleagues, which was built up during the last 20 years with the pennies, with the dollars paid by taxpayers, will be lost. And the context in which I'm experiencing these days The way our implementing partners and our donor agencies are sidelining the Ministry of Public Health as a mother institution, as a coordinating body, as a stewardship institution. The way the coordination is unfortunately lacking among partners, it will have its negative impacts in short term. We will have duplications, we will have lack of synergism, but in the longer term, everybody has to pay for that, unfortunately. So I call on all donors and all partners that despite of the limitations they have today, which I respected, in the past we thought that they will look at the Ministry of Public Health, at the health sector, as a neutral technical agency, and as patients is the right target group. But unfortunately, the context is different today. We have no other options but to respect their limitations. Despite of that, we believe that still the Ministry of Public Health as a technical institution can play the positive coordinating role. Sidelining the ministry, taking it out of the coordination mechanisms, disrupts the system that we built together. It negatively affects the mothers and children that we were propagating. We were promoting agendas for the last 2 decades that we are here to work for mothers and children in this country. Those are affected today. We need a more coordinated,
Rick,
more synergetic approach.
Does the U.S. have a special responsibility here? What can it do?
Yeah, well, I think they do. I think all the donors do. So, I mean, the U.S. is providing some humanitarian assistance right now through a different funding mechanism from the one that's supported the 2,300 health facilities. And I think that they have to step up in other ways as well. We talk about, so we've got the immediate humanitarian needs, but then we need the reinvestment in this big health project that had a budget of $200 million a year that was running the 2,500 health facilities. So, you know, Dr. Majrooh is absolutely right. We cannot afford a rolling back of the tremendous health gains of the last 2 decades, where maternal mortality is reduced by upwards of 60%, child mortality is reduced by upwards of 50%. I did my first visit to Afghanistan in 2000 when the Taliban was still in. The health sector there was threadbare. There's been tremendous progress. We cannot afford that rolling back. So we are putting a lot of pressure on the donors right now to make their decisions. I think Dr. Majrooh is absolutely right as well. We cannot be setting up parallel systems. We've got to build on what exists, build on the NGOs that have the local knowledge, that are on the ground.
Hey, Rick, I've got less than 60 seconds left, and I want to get Diwa in here one more time. Diwa, can you give us kind of the last word on this? And I'm curious what you say to your sisters now and what they're looking at in the next few months coming.
I want to say that there are a lot of Afghan capacity in Afghanistan who are still working for Afghan health system. Not everyone has left Afghanistan. We still have women showing up at health facilities to save lives. I applaud their resilience, and it's important that we invest in these communities. We invest in these people, and we invest in Afghans, and including those who are working in the health sector. But I have my concerns. I'm pessimistic about their future with restrictions that are coming up every day, including restriction on higher education, restriction on work in other fields, restriction on social determinants of health. That's concerning. That will impact health sector one way or another.
That is concerning, Diwa. I have to cut you off there because we're at the end of the show. I want to thank all 3 of my guests for joining us today, and thank you for watching. And until next time, we'll see you in the stream.